Well, welcome back, everyone. Today, I am joined by Dr. ZANE W.M. He's a structural heart director and cardiologist at Lima Memorial, and he's going to talk a little bit about the Tavr procedure that's offered there. So thanks for joining us today. All right.
Good morning, everybody.
Hello. Well, for those of us that are not in the medical field, like myself, what is a Tavr?
Tavr is a minimally invasive procedure wherein an artificial heart valve is introduced through a minimally invasive route, either through the legs or an alternative access. And this is inserted into the aortic valve position of the heart to relieve the blockage of the aortic valve.
All right.
So it's done without opening the chest and without a big operation.
Okay, and so with the aortic stenosis, like what are some of the causes or symptoms of aortic stenosis? What should people look out for?
Aortic stenosis can happen because of multiple reasons. Some people can be born with a congenital deformed aortic valve, or it can happen as a person ages over time, and it's just deposition of calcium, which gets progressively worse and blocks the blood flow out of the heart. Okay,
so now what can a patient might maybe expect before or during or even after a Tavr procedure?
Usually it's an outpatient procedure. Prior to being scheduled for the procedure, actually, there's a few things we need to do, which would include an ultrasound of the heart, which could include a CT scan to determine the size of the valve as well as the access in the legs. And then we will schedule it along with a team of heart cardiologists as well as a cardiac surgeon. And it is done at Lima Memorial as an outpatient procedure. The patient usually comes fasting overnight, and we perform the procedure in our hybrid OR, which we have at Lima Memorial. And usually they stay overnight, and then if things are okay, then they go home the next day.
Wow, that's kind of amazing to hear. It's very quick, in and out. So, wow, that's pretty amazing. Now, if somebody thinks that they do have a heart condition or maybe would like to know more about the Tavr program, how can they contact you?
Well, we do have a structural heart team coordinator, Natalie Lammers, and the number will be listed in this program, and they can contact that. And they will be seen by the cardiology team at Lima Memorial.
All right. Well, Dr. ZANE W.M., thank you so much for joining us today. I do appreciate it.
Thank you.
All right. Well, don't go away because we have more when we return.